turn the call over to my Vice President of Operations. She's going to go through just some standard things that are what we call Zoom etiquette. So please welcome Desiree Ramirez. Desiree?
Hi all, thank you for joining us this morning. Let me just get my screen up. I just want to, just a quick reminder to mute yourself if you have not done so already. There's quite a few of you on here today, so it just avoids the background noise and any disruptions to the speakers. Also, I am encouraging you to use the chat box. There's a chat feature at the very bottom. Go ahead and enter your questions there that you might have. And after every speaker or topic, I will make sure that your questions are answered. All right, just a quick note.
Thank you so very much, Desiree. Please welcome our Chairman of the Board, Mr. Don Williamson. Don? Unmute yourself, buddy.
All right, how about now? I want to thank everyone for being on this call. Thank you for participating. We really appreciate it. You know, the Corona Chamber of Commerce, these are really trying times. I'll tell you, this is not the year I would have picked to have my turn as chairman of the board, but I was chosen to be chairman during these difficult days, and we're going to do the best we can. And I'll tell you what, we're so grateful to our staff, to Bobby, to Desiree and Stephanie and Linda for keeping the fires going, for still supporting our businesses. There's still a lot going on. You know, you look around and you don't realize just how much our chamber continues to function and answer questions and field things that our businesses are asking us. And on behalf of the board, thank you to Bobby and to the staff, because we're still contributing and we're still doing so much to do what we can for our businesses. I'd like to talk about something that's been going on. The Corona Chamber Foundation is something that a few years ago we began and partnered with this foundation to continue to support our community with efforts like the Flag, the Frontline Appreciation Group, which has been partnered again with this Chamber Foundation. What we've done, we've collected money, this group, to go and feed those on the front line of this battle with this horrible virus that's infecting our country right now. And they've collected money and they've taken to restaurants and not donated so much as bought food to help support them, and in turn then give it to give the food and meals to those on the front line in the hospitals and I think the ambulance services and various other of those heroes that are out there pushing back and making people healthy and safe. And I just want to thank them and thank you to those who've contributed to the Flag. And we want to encourage you to continue to do that. And Mary Barnett's the person who started this Flag program and really the one that's been the spearhead of it. So you can get on Corona California Cares and through the Chamber Foundation, make any donations you want to this group as we continue to be part of that team and show honor and show just a little bit of our support for this group of people that is working for Corona. If you want to make a little sign here to hang up, and you can text the Flag to donate. It's right there in front of you on the screen. If you want to make a donation.
Can I just say thank you from the hospital, because we've been a huge recipient of Flag and they've done such a great gift to our frontline workers. We have signs all over our hospital that you all have gotten for us, and the food donations to our night shift have been so well received. So I just wanted to say thank you on behalf of the hospital.
Great. You know, I'm sure they appreciate that, and Linda, thank you. Thank you very much. Now I'd like to move on to some other things. I'm proud and happy to tell you that the chamber is continuing, like I said just a minute ago earlier. And one of the things that I want to tell you about is Bobby's been appointed to an economic recovery task force here in Riverside County that will be meeting every day except for I think Saturday, and they will report to the County Board of Supervisors to talk about what they've decided in their progress. But before I turn it over to our first participant, I want to talk about a phone call that we had this morning with our executive committee of the Chamber of Commerce. And here's a sheet that covered some of those things, some of the talking points. First off, the governor of California is actively looking for ways to restart the economy. And here in Riverside County, here in the city of Corona, we're very interested and part of participating in that. If you look at this slide that's up there in front of you right now, some of the facilities that are being deactivated, 80% of our state hospitals are empty. The healthcare system has worked incredibly during this emergency. And we're so fortunate we haven't really had that predicted dire need of respirators or shortages that we, so far it's been reported that there hasn't been any real loss of life for lack of respirators. And we're so thankful for that. Another thing that, we're getting prepared to reopen businesses and restoring faith and that people can shop and go to restaurants and get back out there and, make return to economic success. There's some estimates that as a country, many states will be back to normal by the end of the year. It's not as optimistic for California per se. We think it will take a little longer for us to get back into the game. But as you can see, here's some information that came from reliable sources that you can look at the footnotes on the bottom to see specifically who gave us this information, mostly from the office of Governor Newsom. And again, you can see there at the bottom. With that in mind, having said all this, I'm not going to take questions now, but I would like to turn it over to our County Board of our member of our County Board of Supervisors, Karen Spiegel. Karen?
Well, good morning. Now that you've taken most of my words, Donnie, that's okay.
Here to help.
I actually want to share a little bit more detail on the Economic Recovery Task Force, the working group that Bobby has been appointed to. We've got 5 districts in Riverside County, and we have representatives from all the districts. We tried to get representatives from the various industries. So from the wine country, we have somebody from the Wine Growers Association. We have agriculture with the Farm Bureau. We've got all over the county, various representatives, so that we can work together, getting the best information so that when we do open, then we will be prepared. We're not just gonna open the doors and everybody go running. That's not a very smart and safe way to do this after everybody's been safe at home for the last couple, 6 weeks now? Anyway, I am very proud that the Corona Chamber is taking a seat at the table. I think this is a very innovative, creative group of business folks that we definitely need to hear from, because what the information is going to be is preparing the best business principles. We're creating toolkits so that businesses have the best information so that they can be successful. We don't want anybody to jump in and not be successful, because that doesn't help anybody. So it's going to be a 3-phase process, and the initial phase is going on right now. It's the next couple, this week and last week, and moving forward, and it's coming to the board with some recommendations so that we can put together a plan, and a plan that the governor would approve of. And then the next phase will be for about 6 months, and that's going to be stabilization. That's, what suggestions were made? Do we need to waive permit fees? How do we work with the cities, with the county? All the different things, TOT taxes, the various things that we may not work in our business, but trying to get the information for everybody to have it. And the last phase will be about 6 to 18 months. And that's basically the details, restoring some of the manufacturing, getting all the job creation and training programs, and all the various things that we need to do to work together. This working group will then submit this to our policy group, which is all of our executive office and in turn we'll put it together and present to the board, and we will be making some decisions. Understand that when Orange County, quote, opened, it's not necessarily the floodgates were open, everybody's out running. There's a very strategic plan that we have to go within the state guidelines. Tomorrow, our orders expire. If you remember right, the County of Riverside had orders through April 30th. We will be, once those are expired, we are under the state 100%. The only one that we're going to keep, I think, is face masks. It's not mandated by the state, but we are going to continue with that. So understand is that now we can't do anything without the approval of the state. So that's what we're going to be working for, is to get a plan that the governor will approve. And in the meantime, we have to get through the day-to-day. And I'm going to introduce Bruce Barton, who is our EMD, our Emergency Medical Director with the County of Riverside, and he will share a little bit of the information on where we're at with COVID.
Okay, thank you very much, Supervisor. Can everybody hear me?
Yes.
All right, well, thank you. And good morning from the Riverside County Emergency Operations Center. I'll move through some of the numbers pretty quickly here, just to share. We don't want to dwell on these. The total confirmed cases in the county are 3,735, 188 of those being within the city of Corona. Our total deaths in the county is 141. 7 of those are within the city of Corona. The metric we're much more interested in celebrating and really gets under discussed is our total recovered, which is 1,303. Additional information and drill down by zip code even is available on the Riverside County Public Health website. That's ribcoph.org/coronavirus. So we continue to see information that is very optimistic. Over the last week, since you got a report last from Jeff Van Wagenen, we've seen continuing in a positive trends in our metrics. Our doubling time, which is the time it takes for cases to double, has extended from roughly 7 days out to 13 days. That's very good news. And we continue to update our models, metrics, and indicators daily, as they are going to be central in the plan to reopen the county, particularly our plan to be received well by the governor, as the supervisor mentioned. It also impacts our planning and spending assumptions. As the supervisor mentioned and the previous speaker mentioned, we're not seeing a surge in the hospitals, but we continue to be challenged by some of our skilled nursing facilities. So we continue our outreach program to those skilled nursing facilities. Across the county, our hospital bed utilization is at 60%. Our ICU bed utilization is at 73%. Those are both very good metrics because as the person who monitors our system day to day, I can tell you it's normally much higher than that. We continue to support 2 federal medical stations, one in Indio and one in Riverside City, just in case we do see a surge. And so we will continue to have those in place. Planning effort for those will continue right now at a minimum through the end of May. We continue to be very aggressive in the county of Riverside with our community testing. Our 4 sites in Indio, Lake Elsinore, Riverside, and Paris have tested almost 29,000 people at this point, and we've tested almost 55,000 people in total within Riverside County. So Riverside County continues to lead the state in the testing metric. The last piece I will touch on is something that a portion of this group, which is our mass care branch, is continuing to outreach with homeless, our homeless program, and coordinating and supporting all of the feeding programs. Feeding is becoming a much larger problem and will continue to be a problem. So we are developing a concept of operations document that includes all of the feeding programs, all of the support and activities from our partners in the cities, as well as our not-for-profit organizations, which include school nutrition programs, and we will keep those in place. The supervisor touched on today's county health officer orders that will be going out, so I won't cover that. And that is the end of my report, other than to say for rumor control, if you're in doubt, please reach out. My cell phone number is 951-232-3841, and you can call me, and I will help dispel any rumors that you may be hearing. And once again, thank you for having me.
Thank you, Karen and Bruce. Desiree, do we have any questions that came along for them?
Yeah, I do. Just to remind all, some people aren't joining on video, they can only hear audio. So if you ask a question, and you see in the chat room, not everybody's going to hear it or see the chat. So I'm going to relay the questions to the speakers. I know you answered it, Supervisor Spiegel, but I'm just going to have you answer it again, just in case people can't see the chat feature. Are you including all of the economic development directors in the region to start the task force?
We have specific industry appropriate people. We can't have all the regional, the economic development directors from each city. No, that's 28 directors. So we have various Chamber of Commerce representative. Suzanne Holland, who is the county executive director for EDA, will be on the team, and she'll be the one that's going to pass your workings onto the policy team. And Rob Moran, who you all know Rob, who is very intricate with economic development, will be the one directly working with the task force. So we'll have to have all the economic development directors from the cities be working with the chambers, because we don't want the group to be so large that we can't really accomplish much. So actually it was staff driven. The Board of Supervisors did not choose the representatives, so they were actually chosen by our staff.
Thank you, Karen. Okay, so for the questions, I'd like to turn the time over now to the CEO of the Corona Regional Medical Center, Mr. Mark Uffer.
Good morning. Good morning. I hope everybody's doing well. I guess I'll give you just a quick overview of where we're at the hospital. We've had, I think, 6 to 7 patients that have expired as a result of coronavirus. We've tested well over 250 to 300, maybe more. The biggest problem we have right now is that the patients that come in that are PUIs, the ability to move them through the hospital quickly is quite limited, and that's all testing related. It takes anywhere from 24 to 36 hours to get a test result back. So we haven't received the rapid testing, that we can do on site and get quick test results. So what happens is PUIs go into isolation. We have a limited number of isolation rooms. They stay in that isolation room until such time as we either confirm or rule out COVID. So you could have anywhere from 17 to 20 rooms tied up in the hospital just on PUIs. And that's the biggest limitation. We plan starting Monday to open the hospital back up for outpatient surgeries and elective surgeries. We'll be doing some spine surgeries, some orthopedics, some bariatrics. And what we're going to do is take one unit in the hospital and secure that as almost a reverse isolation room to keep the patients safe, so that none of the nurses that have worked with COVID patients, none of the physicians that have worked with COVID patients, everybody will be sort of a sterile team to take care of those patients. And we plan to start that on Monday. We're watching this very closely. This last weekend, we had a little bit of a surge in PUIs that we haven't seen before. We know that our hospital in Palmdale has been inundated with a significant number. They're out of LA County. So I think the message is it's still out there, and it's the virus is still quite active. We're hoping to watch the summer weather now, the warm weather, and see if there's a decline. Nothing guaranteed. We're hopeful that this virus will respond like any other flu virus and maybe buy us time to get to the fall and get a vaccine, but no guarantees. I continue to hear people that aren't social distancing and think because things are opening back up that it's perfectly safe to go out there. It's really not perfectly safe to go out there without a mask. You got to protect yourself, wash your hands, don't touch your face, and take precautions until this passes. In the meantime, we're going to continue to do the very best we can to provide healthcare for the community. And again, we've had very few people that have passed away, and the ones that have passed away have all had comorbidities for the most part. So just be safe out there. And if you have questions, I guess if I look at the chat, is that the questions that come in?
Yeah, it's
Desiree. Yeah.
Oh,
it's if you, some people don't know what PUI means, so they just wanted a definition of PUI.
I'm sorry. That's you know, it took me a while to get a hold of that one too. It's person under investigation. It's
Gotcha.
makes it sound like they're a criminal for having COVID, but it's just you know, we've coined the term PUI, and again, we've had a lot of them. I think our test results are somewhere around 8% positive out of all the people we've tested. So it's there. You just don't know where it's at. It's not, you know, we were joking a little bit yesterday. You have to find some humor in this, and I'm a guy that loves humor. But I was thinking like some special glasses that would identify COVID positive people, but they haven't really figured out how to do that yet. But anyway, other questions?
Are there many, yeah, one more. Are there many false positive tests?
There's false negative tests, and that appears to be related to viral load. We've had patients, we heard about it first at GW in Washington, D.C., which is one of the big hospitals, where they had patients that came in the first couple days. They tested them, they were negative, but they were quite sick. They had all the symptoms. So they put them in rooms, and then 3 or 4 days in, 5 days in, they flipped over to positive. So we have had some false negatives. We essentially at Corona, we call it casting a wider net. So anybody that has the symptoms, they're going in isolation until we rule it out. We're just being overprotective. And the value of that is we haven't had, we had one incident where we had a patient that came in that had GI symptoms and no respiratory symptoms or fever, and had a long history of some liver disease. We transferred him to Keck University after 5 or 6 days at our hospital, and he turned positive while he was at Keck. He came back with a positive result. So we had about 14 nurses and doctors and people that had come in contact with him while he was not in isolation. We've tested every one of them, and they're all negative. So dodge that bullet, so to speak.
Right. Anything else? Any others, Desiree?
Yeah, one more just came in. Are patients transferred to other hospitals?
We have only transferred the one to Keck, but that was really for liver transplant. It had nothing to do with the diagnosis. Our critical care intensivist team has done a remarkable job in caring for any of the ICU patients. And we've had as many as a dozen in the ICU, maybe a few more. We have actually 2 ICUs running. One of our ICUs is a COVID ICU. We don't put anybody in there that's not either being ruled out or has the disease or the virus. So we've done very good at sort of segregating the population. I'll tell you the one problem we have had, we've had some people that, and this is my pet peeve, they've acted out in the emergency room. We had one of our nurses who was assaulted. He had a broken orbit in a facial bone around his eye, and he had a fractured nose from a patient that attacked him and frankly beat the crap out of him. So we now have a dog that comes to visit the emergency room. His name's Enzo. Enzo loves to get a bite. So if people act up, they can deal with him. But the social distancing is bringing out the worst in people.
Gotcha. And just for time constraints, one more question. How about the medical professionals? Any COVID positives for the staff?
None on our staff. There was a physician out of Parkview that was just on the news over the weekend that had tested positive and spent some time in the ICU, and thank God has recovered. So you have to be extremely careful.
Gotcha.
Okay.
All right.
Thank you, Mark. I'd like to turn it over now to Mayor of Corona, Jim Steiner.
Well, good morning, everyone. I'd first like to give a shout out to Supervisor Spiegel. She's been really responsive to Corona's needs and always calls me back right away, and just having that accessibility I really appreciate, and so does our council. Kind of like Don said, you know, this probably wasn't the year he'd picked to be chairman of the board, and it certainly isn't the year I would pick to be mayor, but here we are, so we'll do our best, right? So city business continues to carry on. We have over 300 employees now working remotely. You may have noticed extra city crews out the last few weeks taking care of street maintenance and cleaning up alleys. We're just trying to take advantage of the reduced traffic to take care of some of the needed street work as well, and as having our recreation services crew, many of the crews handle some cleanups. So I'm proud of our staff to continue to adapt and serve the community. With the replenishing of funds to the Paycheck Protection Program, we have seen an increase in related questions. We are encouraged to see more businesses apply and are hopeful that these funds dispersed in our community. We are aware of the delay in processing these applications and continue to ask for your patience on behalf of the SBA. The County of Riverside recently received grant funding for workforce assistance programs. This may help support housing assistance, utility assistance, childcare assistance, transportation, and telework equipment for job seekers. And Brian Cortez is probably on this call as well. So if you have specific questions related to that, they should be directed to Ryan. And lastly, I was in a Zoom meeting last week with the Riverside County mayors discussing the importance of having a united front. And as we communicate with the governor and you know, encourage the relaxation of his orders, but you know, they have to be smart, but it also needs to be under a sense of urgency. We have another meeting scheduled for next week. In the meantime, the city will be working to share tools and information on business recovery, and we'll also be launching a user-friendly calendar application with information for business-related webinars. Please continue to share these resources as they come available. If I can answer any questions, I will, and if not, I will turn it over to Chief Young, who I believe is following me.
Okay, hold on, Mayor Steiner. Just one little comment that came in. Any update or anything about that beauty salon here in our city? The one that's opening.
We're right in the middle of that. We're having a special closed session meeting tomorrow. We are addressing it, but we're trying to address it in a smart way. We don't really want to go arrest people, and we don't want to, have them have to owe more money to somebody. But we also, we're strongly encouraging compliance, and we will take the appropriate action to deal with it. But we need to discuss this as a council first, and the only way you can do that is by having official meetings. So we're on it. Just be patient.
And for those who are not aware, the mayor's referring to a business has decided, even though they're not supposed to open, to in fact open. That's what the mayor's referencing.
Correct. And, as citizens and businesses become more antsy and the anxiety builds up because they can't pay their bills, and because some people believe that their constitutional rights are being affected, so they're going to do what they think they have to do. Clearly, we need to protect our community, and the safest way to medically protect our community is following the advice of our doctors and scientists. However, our scientists and doctors also need to understand that we have an economy that we need to keep going and businesses that we need open. So there needs to be a fine balance of how we go about this, but it needs to be very smart as well.
Gotcha.
Okay.
That's all I have for Mayor Steiner.
Okay.
Thank you.
Thank you, Mayor. Chief Young?
Good morning, everybody. Thanks again for the invite to give you kind of an update as far as what's happening from the City of Corona's Emergency Operations Center. You heard from Bruce Barton at the county level. Just as far as systems approach, the City of Corona EOC works directly with the county EOC to create continuity of operations and make sure that we're all in alignment and we're communicating, collaborating to get those services that are provided, obviously from the state level down to the county level, here locally to the City of Corona. So we're currently activated at level 2 in the City of Corona, which is one lower than the highest level. And the only differential there is that every position is not filled, but multiple key positions are filled in our Emergency Operations Center. We are transitioning though into multiple day planning cycles. And the benefit of that is just from understanding the structure is instead of having 3 conference calls a day, we're having only 3 conference calls several days a week, and we're creating 1-week planning cycles. So as I've stated on past calls, we have a very well-established information line that's been established in the city, and it's being used for all different types of questions. Something as broad as mentioned by Mayor Steiner, civil liberties and constitutional rights are brought up on there, as well as just access to resources that are out there for our at-risk communities. So the nice part about that is it meets every potential demographic. People can email their questions, they can phone in and talk to a 24/7 human being, or they can even text their questions. So it's been very effective, and it's meeting a lot of the needs and desires of our citizens, as well as those in our business community, even offering services. It's all routed appropriately. We have a very well-structured system in place to best utilize that information that's coming in. One of the biggest evolutions, as I mentioned last week, was the enhancements to our care and shelter branch, and specifically our donations manager. And what this is doing is it's aligning the donations that are coming in from either personal contributions or the business community, and finding the most at-need portions of the population. So it's really creating that supply chain for availability and those in need. As was mentioned by Mayor Steiner, additionally is approximately 1/3 of our workforce is working remotely or telecommuting, and a significant byproduct of that, of being good supporters of the distancing and all the recommendations that are coming out from the state and the county, is that we have had no city staff that have tested positive. Tragically, one of our city staff did lose her husband to COVID. However, there has been no city staff that has actually tested positive for COVID. And I truly believe that's a direct reflection of following the recommendations that have come out from the medical experts dictating the best practices to mitigate that. One last thing I will throw in there is we're all seeing an increase in traffic and activity out in the public, unfortunately. That has also returned our call volume from the public safety perspective, police and fire, back to normal. So for approximately 4 to 6 weeks, we saw a significant reduction in 911 call activity, obviously because people were doing what they were supposed to do, but that has now gone, and our call volume is back to normal. And as a point of reference, we basically had no traffic accidents. It's a generalization, but for lack of better terms, no traffic accidents for several weeks. Back to 8 to 10 a day. So that's a direct indication of things are changing out there. But we just really need to stay the course and make sure that we're supporting, at the same time understanding that things are changing. So once again, thank you for the invite. I'm grateful to be partner with the Chamber. Several of the people on the call are close relationships, whether it be professional or personal. So I thank you all for what you're doing. Obviously, you are a significant positive to getting through this as a core component of our city. So thank you all for, number one, inviting me, and thank you for all that you do.
Thank you, Chief. Thank you, Chief Young. We really appreciate you and your department. Desiree, any questions for the chief?
For Fire Chief, no, it's just a general law enforcement question about if speed traps are being set up around town. It's affecting delivery drivers to their businesses.
I can't speak to fact, but my understanding is no enhanced enforcements are being placed during these times. But if there is a direct question, they can reach out to PD through their general information line, and somebody will get back to them.
Thank you. No other questions.
Okay, moving on then, it is my pleasure to introduce our featured speaker, Dr. Angelov Farooq. Dr. Farooq has been a member of the California Workforce Development since 2013. This is a position that's appointed by the governor of the state. He is currently serving as chairman of the board, and he is also a member of the Riverside Unified School District School Board. So it is my pleasure to introduce to you Dr. Farooq.
Thank you, Don, and good morning, everyone. And it's a pleasure to participate on this update with all of you. So I want to first begin by just acknowledging the great leadership that you guys are fortunate to have with Mr. Bobby Spiegel, with the Corona Chamber. This is not only a time where I think just having the pulse and getting information out to people is critical, but I want you to know that through the Corona Chamber and through Bobby, that you guys have direct voice to the governor's administration. And we are very intently engaged with the chamber here, as well as the county of Riverside and Supervisor Karen Spiegel on whatever kinds of aspects we can shape our policy decisions. So just really want to, again, commend the leadership here. One other thing I want to acknowledge is, I don't know if all of you are aware that it was several months ago that the President Trump appointed Jeff Stone to be the Region 6 Director for the U.S. Department of Labor. So it's for the whole Western United States. And that's basically my counterpart at the federal level on the workforce side. And I can tell you, for those of you that know Jeff, he used to be a former county board of supervisor. He was in the state legislature, but he has been extraordinarily helpful, very responsive, making sure California is being taken care of through his Secretary Scalia. I just really wanted to give a shout out to Jeff Stone about that as well. So I'm just going to give an update, one about what's happening with our workforce development system under Governor Newsom, some updates about just what the administration overall is doing in terms of starting to shape the reopening of the economy and what that looks like. And then lastly, per the request of Bobby Spiegel, he wanted me to touch on this program on restaurants delivering home meals for seniors. So this is kind of an overview of what I'm going to go over. So to start with, on the workforce development side, one of our focus is the high road labor exchange. And so what that means is we've been focusing on training and transitioning workers from non-essential jobs to essential jobs like healthcare, food workers. And the governor also had launched this Health Corps platform to attract retired medical professionals and current medical students to help expand the capacity of our healthcare workforce system. And when we say high road, we're just meaning that there's a focus on job quality, meaning livable wages, benefits, worker voice, and so forth. One other thing we've been doing is we've been coordinating with our counterpart in the economic development. We refer to it as GoBiz, the Governor's Office of Business and Economic Development, to help transition manufacturers towards the production of PPE if they're not able to be functioning during the shelter in place. And I want to give a shout out to one of your local Corona Chamber members. I think he's on the call, Chad Miller from Industrious. He's been one of the people at the forefront on those kinds of efforts of, again, transitioning manufacturing towards PPE. And that's vital also for our local economy, because the more we're not reliant on China or anywhere else in the country to be able to provide critical medical supplies for our hospitals here in Corona and the community and other uses, the safer we're all going to be. So just definitely want to acknowledge that. The big discussion on workforce, unfortunately, has been about the unbelievable surge in unemployment claims. And Governor Newsom has really played a very strong role in expanding the capacity to service these claims. So he has assigned over 600 state employees, a total of over 1,300 workers overall, so that our call centers can be 12 hours a day, 8 a.m. to 8 p.m., 7 days a week. That's the most expansive in the country, the first to do that. The phone number for anybody who does need that is 833-978-2511. But if you go on EDD's website, Employment Development Department for California, you can get that and file a claim online as well. You do not need to call in, by the way, to file a claim. Secretary of Labor, Julie Sue, and her staff have been working around the clock to process claims during evenings and weekends. The big development on unemployment that's probably more relevant to the Corona Chamber is through the Pandemic Unemployment Assistance, the PUA, which was part of the Congressional CARES Act. For the first time in history, self-employed, independent contractors, business owners, gig workers, they can actually, that do not pay into unemployment insurance are now able to apply for unemployment. Now, I want to encourage people, and I'm sure, through the chamber, you're aware of this, that the Payment Protection Program, the PPP, if you're a business owner, that's by far your best bet. If you qualify and are able to have your lender work with you to get processed, that should be your first priority if you're a business owner. But if you're a small business and you're self-employed and you're not able to do that or get processed, know that you can apply for unemployment. And just go through the normal EDD unemployment claim filing process online, and there will be new questions that are tailored specifically for those people. And the other good news about this is that if you qualify for your claim, you can backdate when you were impacted by the COVID-19 based on your last day of work, or that your self-employed independent contractor could function, and you could receive potentially payments for those prior weeks. And so one of the enhanced benefits, which applies both to the self-employed independent contractor business owners, as well as the traditional unemployed, is that there's an additional $600 on top of whatever you normally would get per week. And that's irrespective of income. And that will apply for the weeks between March 29th and July 25th for those $600 extra payment per week. Shifting gears now about the governor's plan to reopen the economy. So the governor had created a task force co-chaired by businessman Tom Steiner and his chief of staff, Ann O'Leary. And there's about 70, 80, major business leaders from wide spectrum of sectors. Just know that, I communicated with the governor on Sunday personally, and I encouraged him to have more of a voice from inland California. And so, he's just told me he's taking notice of that. So hopefully we'll be seeing more engagement there. But again, through the leadership of people like Supervisor Spiegel and the Riverside County Board of Supervisors, you guys are very much well represented and have your voice there. In terms of the plan to reopen the economy, right now, the indication is that in a matter of weeks, not months, the governor will slowly start phasing the reopening of businesses. In the initial phase, the focus will be on non-essential manufacturing, since obviously essential manufacturing has already been functioning. That could be one of the early types of businesses. Businesses that offer curbside pickup beyond restaurants and so forth could also potentially be opened up in this phase. Businesses that do not adapt well to remote work but can still maintain safe guidelines. Those will be kind of the initial phase. The future phase, meaning it won't be in this initial one, will be businesses that have more personal interactions, such as nail salons, movie theaters. Unfortunately, in-person religious services. I know our church community and faith is always important, but it's even more important now with these crises. We're going to have to continue to try to be creative to hear the word and get connected with the faith community. Major events like concerts, conventions, live sports will continue to be prohibited statewide until the stay-at-home is completely lifted. Another development regarding education, the governor is targeting early start to the next school year, meaning as early as potentially late July, early August. And the intention, and again, this is not an official thing, these are things that they're trying to work through, is to make up lost time for students that had limited, even through distance learning, they had limited opportunities at the close of last school year. And it also serves as a form of daycare option to help people get back to work earlier as well. And per Bobby Spiegel's request, I wanted to share just a little bit of info about this First in the Nation Restaurants Deliver for Seniors program. The only caveat is a lot more details are to come in terms of how to sign up as a restaurant, or if you're a senior that needs those meals. But this is a partnership with counties, cities, and tribes. The goal is to help older and other high-risk adults stay at home and allow the delivery of 3 meals a day. And the other benefit is we want to definitely provide an economic stimulus to local restaurants and workers that are struggling through the crisis. In California alone, 1.7 million seniors live alone. The benefits that through these funding efforts, again, through combination of state, FEMA at the federal level, and local governments, will allow restaurants to receive up to $16 for breakfast, $17 for lunch, and $28 for dinner. Again, in terms of how to sign up for that, the governor will be releasing those details soon. But for now, that's the information that I have to share with you. So that's my update.
Okay, I have one question is, do you have an expected date for hair salons to open?
So the sense is that hair salons might be in the second phase because there's more of a direct interaction. We don't even technically know when the first phase is. The only indication the governor's provided is that it's quote unquote weeks. They're closely monitoring data, and public health experts are going to guide that process. And obviously, the more that people adhere to shelter in place now, the sooner that it will likely happen. But unfortunately, I don't have any specific dates beyond that.
Gotcha. I don't have any further questions. No more questions in the chat room.
Thank you, Dr. Farooq. We're going to really appreciate your time and the valuable information you presented. Thank you so much.
Thank you.
We're going to close it out this morning with Bobby.
Yes, I just wanted to thank everyone for being on here. We had the record attendance of over, at one point, I think it was 96 people on the call. I'm very, very pleased over that. Dr. Farooq, thank you. Thank you to all the speakers that shared. And Desiree, if you could pop up real quick, we have got our Good Morning Corona breakfast that will be Zoomed on the May 15th. We have our district attorney, Mr. Mike Hestron, who will be our keynote speaker, and it is being sponsored by Riverside Medical Clinic. There is a bit.ly there if you could go ahead and register on. We would love to have you as part of that. On behalf of the Corona Chamber, the board of directors, and all the businesses in our community, we just want to say thank you for believing in us and working with us. We're going to get through this. We can all work together. We'll see you next Wednesday. Have an excellent day. Thank you.